We shall fight in France. We shall fight on the seas and oceans. We shall fight with growing confidence and growing strength in the air. We shall defend our island, whatever the cost may be. We shall fight on the beaches. We shall fight on the landing grounds. We shall fight in the fields and in the streets. We shall fight in the hills. We shall never surrender.
Hey everybody, what's up? I am Matthew Garrett, and welcome back to Midwest to Gotham. We're going to get involved in another part of my famous segment, which is called Tell Your Story. On Tell My Story, what you do is we take somebody from our community, bring them on the show, which gives them an opportunity to talk about things that they want to talk about. You know, my channel is all about giving people who don't have a voice, and letting people who have something important to say, who don't have another way to express themselves, an opportunity to tell people what they feel about. If we're all going through the same issues, the same struggles, if we have 100,000 people going through the same problem, you put 100,000 voices together, 100,000 minds together, we can overcome our obstacles together. So that's what my show is about. I want to bring it back a little bit because when I first started this, I would say a couple months ago now, I did my first interview with someone very close to me named Sylvia, and we did an interview with her about some of her health problems. We didn't even finish it, and she immediately got ill again and has not been able to return to finish it. But I want to put out what she has so far because I think that her story is real and a lot of people will be able to relate to it. Sylvia has been going through health problems probably for easily the last 20 years. She's one of the bravest people I know, just been able to function with all the different issues she has to deal with, whether they're the extreme health issues she's having, the financial burden that comes along with anyone who has major health issues. I mean, it's a lot. Like I said, everything that happens in real life, this is about as real TV as you're going to get. Everything that happens in life isn't positive, and this is one of those. So try to end on a good note, but realness is what's important. So we're going to go to the snippets of the interview that we did a couple months ago with Sylvia, and you can hear part of our story. Hey everybody, what's up? This is Matthew again, and welcome to my show, Midwest to Gotham. And as you can see, I am not in my lovely home. I am out doing an interview, and I'm out here talking with a very good friend of mine,
Sylvia Garrett. Thanks for having me.
Oh, thank you for coming. And we're going to have a talk about healthcare. Unfortunately, Sylvia's had a very long road in the world of healthcare. She's had a lot of ups and downs, and I feel that her story relates to a lot of American stories. So we're just going to launch right into it, and hopefully you find some value out of this information. So let's start off here. Can you just explain some of your healthcare issues? I know you have a lot, so just give them a scope of exactly what you deal with.
Okay, well, unfortunately, my situation has been extensive, so I'm gonna slide over some things. I'm gonna say that my last episode, I had a knee replacement. They've replaced it 3 times in the same leg. Unfortunately, I ended up getting a MRSA staph infection. That's a very strong staph, and it could kill you if you don't have the right medication. So, how does my story affect you? I am here today because I do want to speak out for people that didn't have a voice or don't have a voice. And just because you have health care now, you never know what's going to happen to you. So it does affect you with what our government does.
So I want to go back real quick. So we have a staph infection issue, and
I have a staph infection, I have lupus, I have an infection in my back that broke my 4th and 5th vertebrae. So there are particular medications and combinations of medications that they try to control my pain.
Now these are not issues that you've had. These are all issues you're dealing with simultaneously right now.
Right now, and for the last 5 years. And when I first started out, I was working, I had a different insurance plan, I had a decent job. So for all, if you don't think it can happen to you, I'm here to say it could happen to anyone. So be careful. You're not safe because you're working today and you have insurance today. You may not have it tomorrow.
So you would have titled yourself middle class?
I would have titled myself middle class. I have an average salary of about $28 an hour. I had an insurance plan, and I was making it. I was in the middle class. I was comfortable. I was happy with my life. I was getting my piece of the American dream when this happened. So I had to go out on disability. So the first thing, your job is only going to let you be gone so long. So after a couple of years, you know, they had to go ahead and medically retire me. With that, I lost my income. So everyone was like, let's go get on disability, because everybody thinks as soon as you find out you're sick, you're going to get disability. First of all, it takes about 6 to 9 months to receive disability if they don't turn you down.
But so you're saying that you're already out sick and injured, you're not getting paid from your job anymore.
Right.
And it still takes an additional 6 to 9 months from that point for your disability to kick in.
That is correct. And it's in 6 to 9 months, how you live is
You got to figure it out.
the best way you can. So unless you have family or friends that can carry you, you are up the creek without a paddle. It's just horrible. So once you get disability, they will back pay you the 6 to 9 months. But I mean, what are you supposed to do for 6 to 9 months? And then because you get disability doesn't necessarily mean you get Medicare right away. That is a total different entity. You have to apply for it, and then they'll decide and let you know. But what you get on Medicare is totally different from your insurance plan on your job. I had an optimum plan before, which means that I got the best medical care I could. I got the medications I needed, and it was no problem. You get to go to the best doctors. But on Medicare, you have to go where the plan extends you.
Right.
And you have to wait a certain amount of time. If you don't get in at the beginning of the year, you have to wait 6 months. You can only apply at the beginning of the year, and it takes 6 months. So I applied in December, but I didn't get it till July. But in the meantime, our government says that if you don't have insurance, you get penalized on your taxes. So I had to go out and get Obamacare, which was, Obamacare did save my life. I'm for it. If I didn't have it,
So you were
I
positive,
wouldn't have anything.
I'm sorry, I didn't mean to cut you off. So you were positive towards the Obamacare.
I was positive because if I didn't have that, I wouldn't have anything, and I would really be dead. But what Medicare doesn't tell you is that, you know, you have to pay. I paid a certain amount for Obamacare for the whole year. So Medicare kicked in, I applied in December, kicked in July. If you don't take it then, you have to wait till the next year. But I've already paid for Obamacare.
Right.
So I was like, okay, I asked Medicare, I said, well, I've already paid for this insurance to the year, because you know at the beginning of the year, that's when you pay all your co-pays until you get down to zero. So I was in my 7th month, so I was where all my medication was free instead of just paying $100 for, like, you know, I'm paying like $600 to $1,000 a month on a 1528 disability, but they wouldn't count it. Because on disability, when you receive it, if you receive more than $1,200 a month, you cannot qualify for any program. They will not take your income into consideration. So I got $1,528, $328 more than the $1,200 that was a requirement. If I got $1,200, then they will take my house payment into consideration, my car payment, my prescription co-pays. They'll take all that, and so then there are programs that will pay you. But because I made so much money working, trying to get the American dream, everybody's running for the American dollar.
You're really making so much money?
Not so much, right. It's not what it looks like on paper, but what it looks like on paper is what they go for. So they were like, oh, you're $328 over what is required for these programs. So I was like, look, take the $328 back, because I need help with these prescription medications. I can't pay my rent and my car note and everything I had before the unfortunate sickness came. So I don't need the money. I need the programs. I need the medicine.
So you feel that you were better off without the money?
Right. Because, I mean, $328, I mean, you know, if you're paying out, let's just say on average $600 a month for utilities, $300 or $400 for rent. You know, if you pay $600 for rent, if I'm paying $300 or $400 for a car note, because mind you, I made $28 an hour, so my bills matched up to that. But when I got on disability, I mean, 1528 doesn't go very far.
So I don't know anything about this process as far as I have insurance through my employer. Because I'm told this is all new information for me too. But it sounds like, as I said, from my viewpoint on the issues that I believe in, where I believe that healthcare should be a universal right for everyone.
I do too.
If you don't believe that, if you believe that you should be able to pull yourself up by your bootstraps, it seems like the system, and don't let me put words in your mouth. If I'm wrong, check me. It seems like you can't pull yourself up by your bootstrap, because if you do do better, then the benefits you need to live, your health care, is taken from you.
That is correct. You cannot pull yourself up by the bootstrap because the system is systematically in place to make sure you can't.
Wow.
Because if you make too much money, then you're going to get less help. But who knows? You never know when you're going to get sick. You don't know what's going to befall you in life. And you would like to think that the thought process of most people, mine was, well, I worked all my life. I've been working since I was 16. I've never been on welfare, never been on food stamps, never asked for any help. I worked and paid my bills, and I paid them on time. But now, when I couldn't work and I do need assistance, now you have all these people getting assistance that didn't need it. There are people that abuse the system. But what about people that have a track record of not doing it?
Right.
That's too bad. You're out of luck. Shit slides down the wall. So when they don't like Obamacare, most Republicans, they're against it. How do they beat it? They were like, we can't stop Obamacare, but what? Most doctors, most lawyers, most people like that are Republicans, and they are for, hey, pull yourself up. So who cares? I mean, if it's not happening to them, who gives a rat's? Fall too. But when you're the one sick, you're like, hey, can someone help me? I'm going to die. I mean, we see these jokes and we've seen these people are falling and I can't get up. Everybody heard the sad stories about the elderly senior citizens people who are choosing between medication and food, eating dog food. And you're like, wow, that couldn't possibly be going on. But it is.
Now, you just struck a chord. Like I said, there's a big difference between what happens on a governmental level and what happens on a micro level between the individual. So you're saying that these policies that are in place, when these policies go through, the wrong policy could actually kill you.
Exactly. I'm going to say that if my mom and dad, who are in their 70s, who have worked their whole lives to enjoy their retirement, if they were not alive, I would be dead. Wow. Because what they can do, I mean, they can't stop Obamacare, but what the doctors can say is, I don't accept that policy. They reject you. We don't prescribe that. We don't cover that medication. I mean, you go to the doctor, if you have to go to specialists and everything is $45 your copay and you only have $15.28, how far is that going to go? And then when you get to the pharmacy, oh, we don't cover that on Obamacare, so now that prescription is $100. If you have 6 prescriptions that are $100, that's $600 already gone from your $15.28. So, and they won't consider the fact that you have to pay rent and you have to live somewhere. You can virtually lose everything. I was basically homeless. I was floating from place to place. Then they're like, why don't you get on Section 8? Because there's a waiting list. I was 3,995.
Say it again.
3,995. And that was 5 years ago. Guess what my number is now? 2,100 in 5 years. I'm still on the waiting list. 2,100 people still in front of me. I would still be homeless, floating. I live with my daughter. I live with my parents. The doctors were like, look, this insurance is not covered. We can't run the test you need unless you can pay out of pocket. Pay out of pocket with what? I only make $15.28 on disability. You won't take the $328 back, because if I made $1,200 on disability, then I could qualify for all these other wonderful programs. But I mean, it's almost like, if you're in this rat race trying to get the money, trying to get the American dream that they sell you, you better make sure that you never stumble and fall, because if you do and you don't have a safety net, you're going to die. I mean, choosing, there have been many days when I just did not know where my next dollar was coming from, how I was going to put gas in my car, how I was going to buy food.
Hey, everybody. I decided to go ahead and stop the video there. Sylvia has quite a story to tell about her life, and we're at about the 15-minute mark. So I figure it's a good time to stop. I want to break this into segments that's easily digestible for people, and I don't want to go on too long. It's not my normal segment. I try to end on a happy note, but this is what I'm really about. It's about real talk and real stories. So as we know, if you live a life that every story doesn't end on a good foot. So it's all about just telling the story. It's not always about making people laugh. So we're going to stop there. Hopefully we'll pick it up soon. Give your prayers that Sylvia has a fast recovery and she's back on her feet. And until then, my name is Matthew. This is Midwest to Gotham. I'll talk to you soon. Bye.